Hello everyone, my name is Nya Hughes. I am a medical laboratory science student. I am training and working closely with diagnostic samples, ensuring they provide accurate and reliable results to guide patient care. Today, I will be speaking about the importance of proper collection techniques for wound, tissue, and bone samples. These types of specimens are crucial in diagnosing infections, monitoring treatments, and making critical decisions for patient management. This presentation will emphasize why correct collection methods are essential, the potential consequences of improper practices, and how we, as a healthcare team, can ensure the highest standards in sample collection. First, I want to discuss why proper sample collection is so important. Laboratory diagnostics play a pivotal role in modern medicine, guiding clinicians in making accurate diagnosis, determining appropriate treatments, and monitoring patient outcomes. However, the accuracy of these results depends significantly on the quality of the sample provided. Improper collection, whether due to contamination, insufficient values, or mishandling, can lead to diagnostic errors. For example, a contaminated wound swab might result in the isolation of non-pathogenic skin flora instead of the actual pathogen, leading to inappropriate antibiotic therapy. Similarly, insufficient tissue samples can delay diagnosis, prolong hospital stays, and negatively impact patient outcomes. Ultimately, the quality of the specimen is directly tied to the quality of care we can provide. Proper sample collection is not just a technical skill, but a cornerstone of patient safety. On my next slide, I will discuss key considerations for sample collection. There are some universal principles to follow when collecting any type of specimen. First and foremost, always use aseptic techniques to prevent contamination. Ensure the sample is adequate in value, as insufficient samples cannot allow for comprehensive testing. And lastly, proper labeling and documentation are also critical to avoid errors that could lead to patient mismanagement. In my next few slides, I will be discussing the proper collection for wounds, tissues, and bone samples. When collecting wound samples, it's important to recognize the difference between superficial contamination and the actual site of infection. For acute wounds, such as a surgical or traumatic wounds, and chronic wounds like pressure ulcers or diabetic foot ulcers, the collection technique matters. Avoid swabbing necrotic tissue or superficial exudate, as these do not represent the true pathogens causing the infection. Instead, cleanse the wound with sterile saline to remove debris and then collect the sample from the wound base or the leading edge of the infection. Use sterile swabs or, for deeper infections, aspirate with a syringe. This ensures that the sample accurately reflects the clinical infection. Our next topic, tissue samples. Tissue specimens should be handled gently to avoid mechanical trauma, such as crushing or tearing, which can compromise histological evaluation. Ensuring the specimen remains moist by wrapping it in a saline damp gauze is recommended to prevent desiccation. Prompt fixation of tissue samples is essential to preserve cellular morphology. If immediate fixation is not possible, specimens should be refrigerated at 4 degrees Celsius to prevent autolysis and degradation. Our next topic, bone samples. Bone specimens often obtained during surgical procedures should be collected using aseptic techniques to prevent contamination. It is crucial to avoid contact with non-sterile surfaces and to use sterilized instruments throughout the process. Place bone samples in sterile containers, ensuring they are appropriately labeled with patient information and the specific site of collection. Prompt transport to the laboratory is necessary to maintain specimen integrity. In this slide, I will be talking about this article, A Comprehensive Review of Interdepartmental Collaboration of Enhanced Patient Care, which emphasizes the critical role of effective communication and cooperation amongst various hospital departments in improving patient outcomes. It highlights the interdisciplinary teamwork that leads to more accurate diagnosis, effective treatments, and overall enhanced healthcare services. This article also identifies common barriers to successful collaborations, such as stratified structures, communication breakdowns, and suggests strategies to overcome these challenges, which include regular interdisciplinary meetings and the implementation of integrated care pathways. By fostering a culture of collaboration, healthcare institutions can ensure more comprehensive and patient-centered care. In this slide, I have a chart that lays out the reduction of mortality and morbidity based on a case of cooperation between emergency department and ICUs. Average transfer time is represented in minutes, mortality rate is represented in percent, and so is patient satisfaction. For pre-collaboration, the average time is 90 minutes. For post-collaboration, it reduced to 45 minutes. Pre-collaboration mortality rate shows 8%, while post-collaboration reduced to 5%. And lastly, patient satisfaction for pre-collaboration shows 70%, while post-collaboration increased to 90%. In this slide, I made a chart showing the key metrics before and after implementing collaboration strategies. The average time before collaboration was 90 minutes, while the average time after collaboration reduced to 45 minutes. Patient mortality rate before collaboration was 8%, while after collaboration it reduced to 5%. Patient satisfaction rate before collaboration shows 70%, while after collaboration increased to 90%. Remission rate for before collaboration shows 15%, while after collaboration it decreased to 10%. Staff burnout rate before collaboration is at 30%, while after collaboration it reduced to 15%. Procedure delays before collaboration shows 20% of cases, while after collaboration it reduced to 5% of cases. And lastly, length of stay before collaboration shows 8 days, while after collaboration it reduced to 6 days. Let's take a moment to address some common errors that occur during specimen collection and discuss ways to avoid them. One frequent error is collecting superficial swabs instead of obtaining material from the actual infection site. For example, swabbing a wound's exudate rather than its base can lead to the isolation of commensal organisms, which may not reflect the true pathogen. Another issue is using the wrong transport medium. Anaerobic pathogens, for instance, require specific conditions to remain viable. Failure to use the correct media can render the sample unsuitable. Delays in transporting the specimen to the laboratory can also compromise its integrity. Some pathogens, like anaerobes, are highly sensitive to environmental conditions, and delays can lead to false negative results. Finally, mislabeling or leaving out key clinical information on the requisition form can lead to incorrect processing or interpretation of the sample. These errors are preventable through adhere to protocols, the use of standardized checklists, and clear communication with the laboratory. Next, I will discuss role of the laboratory in collaboration. It is important to emphasize the collaborative nature of patient care, particularly when it comes to specimen collection. For the laboratory's perspective, we rely on healthcare professionals to provide properly collected, labeled, and transported specimens along with complete clinical information. This allows us to perform the necessary tests and deliver accurate, timely results. In return, the laboratory provides not only results but also guidance. If you're ever uncertain about the proper collection technique for a specific sample, the lab team is always available to assist. This partnership is vital. When healthcare professionals and the lab work together effectively, we reduce diagnostic errors, improve treatment accuracy, and most importantly, enhance patient outcomes. In conclusion, proper sample collection for wound, tissue, and bone specimens is a fundamental aspect of patient care. By adhering to best practices, we ensure the accuracy of laboratory results, prevent diagnostic errors, and contribute to better clinical outcomes. I encourage all of you to remain diligent in following protocols, seek clarification when in doubt, and collaborate closely with your laboratory colleagues. Together, we can ensure the highest standards of care for our patients. Thank you for watching my presentation. If you have any further questions or any concerns, please contact me at my email, nh3427@pcom.edu, the NH is lowercase, or my number at 973-847-9382. Thank you and have a wonderful day.